Hello. Today we're going to talk about the elements of a healthcare liability lawsuit or negligence, often referred to as a medical malpractice case. For a healthcare liability case or medical malpractice that alleges negligence on the part of one or more healthcare providers, it requires the plaintiff's attorney, that would be the attorney suing on behalf of the patient or the patient's family, or whoever had standing to file the lawsuit, and that's suing the healthcare providers. The plaintiffs have to prove the following elements. They have to prove that there's a duty, that the healthcare provider owed a duty to the patient, that the healthcare provider breached that duty by failing to meet the standard of care, that the failure to meet the standard of care or the breach of the duty caused harm to the patient, and that the patient suffered harm from the healthcare provider's breach of the standard of care. So we've talked a lot in this course about duty, both for physicians and hospitals or healthcare entities. And as you'll recall, the physician's duty is basically related to an implied contract. It is generally voluntary, and a physician decides who they choose to accept as a patient. Now, there's quite a few caveats to that, and if a physician is on call in a hospital or working for a healthcare system in some way to provide care for patients, then they may have a duty even if they've never seen the patient before. A good example of that would be for an emergency room physician who is taking a shift in a hospital's emergency department. Then patients walk in the door, the physician clearly has not selected those patients. On the other hand, neither of the patients selected that physician, but there's still an agreement, if you will, because the physician is on shift there. They've said, I'll treat the patients that come in to the emergency department. A little bit different than, or quite a bit different than hospitals and healthcare entities' duties to patients, which are often based on them being quasi-public type facilities. They typically accept federal funding. They're licensed and governed by regulatory bodies. And if we're talking emergency care, then EMTALA is the federal law that will impose a duty on the hospital to provide care to patients seeking emergency care. Nurses, technicians, and other employees of the healthcare entity or the hospital will have a duty because they are employed there to provide care to the patient. So even, for example, if you have a nurse working in the ICU and they're going down to the cafeteria and they, run across a patient who is in trouble, possibly even a visitor, then there likely will be imposed a duty just because the person is in the hospital working and going to have some responsibility to anyone that's in that facility. It may be a different standard of care than the nurse would be providing to the to the patient up in the intensive care unit, but there will still be, in all likelihood, a duty, even though the patient may not be paying or may not even be a patient at the time. It could be a visitor. That gets us a little bit into something that is, I think, worth mentioning, where you've probably heard about Good Samaritan laws. And Good Samaritan laws are there. They're different in each jurisdiction, but they're generally there to protect a healthcare provider who volunteers to provide emergency care or really any care to someone who wasn't previously a patient. So a Good Samaritan law, the reason for it is so that it encourages healthcare providers to stop and render aid at the scene of an accident. I mean, if a nurse or a physician's on their way home from work or headed down to the grocery store or whatever they may be doing, and they encounter an accident, then the law wants to encourage them to stop and render care. There's no obligation to stop in that type of situation, but the Good Samaritan laws would encourage that type of behavior. In a hospital, for example, we're back to the scenario of a nurse going down to on her lunch break to the cafeteria, and if they were to encounter a patient needing or a person needing immediate care, the Good Samaritan laws would likely not apply in that situation. You can make an argument But the fact that the person is on duty, getting paid, even while they're going down possibly for a break, they may have a duty. Again, it would just then be determinant on what's the standard of care in that situation. Standard of care. How do we know, when a duty does exist, then how do we know what the standard of care is? Well, the law imposes a duty to exercise ordinary care, which is that degree of care that a reasonably prudent healthcare provider who is the same type of healthcare provider or is providing similar care as to the person at issue, that they would have exercised under the same or similar circumstances. So for nursing standard of care, we'll look to see what other reasonably and prudent nurses would have done under the same or similar circumstances. For physicians, you look to see what would a reasonably prudent physician have done under the same or similar circumstances. Now, one thing to note is that the law imposes ordinary care. So what is ordinary care versus best practice? And hospitals and healthcare entities, physicians holding themselves out, advertising, they may advertise and want to live up to best practice standards. But the law does not impose best practice standards. Now, there's ways that healthcare entities or providers can hold themselves out and create a higher standard for themselves. For example, if you were to advertise that, as a hospital, that we have the best spine care, come to us to have the best care. We follow best practice guidelines and principles. Then, a judge may let a jury consider that it's not ordinary care, but this facility has held itself out as offering best practice standards or better care than their other competitors or reasonably prudent entities or providers in the same or similar situations. You have to be careful about advertising and holding out to a higher standard of care. What's not relevant to the standard of care? Well, good faith, the fact that someone meant well, that a nurse or a physician or a technician, I meant well, I intended to provide you with, ordinary care with, the care within my ability. The fact that they did that in good faith and meant well does not establish the standard of care. Healthcare provider practiced to the best of their ability. That really doesn't go to the standard of care either. We have either a local or really most jurisdictions now follow a national standard of care. It's not what, you did this to the best of your ability. We're sorry that you weren't trained very well in this. No, you are required to practice and provide care according to the standard of care that can be established in the case. That, the healthcare provider was too busy, had other responsibilities. And you see this crop up in cases, from time to time is we had, this was in the emergency department. We have 3 other patients with, severe emergencies going on that were requiring a lot of personnel. And so we didn't have time or the personnel to take care of, this person or provide the standard of care that we ordinarily would have. That does not matter. Each and every patient is owed the standard of care that can be established in the case. And we'll talk about how you establish the standard of care. Now, those things may come in as mitigating factors. A jury may be allowed to consider those type of things, but it really doesn't establish the standard of care. The standard of care will be established in the case, and then those other factors may or may not be able to come in for some type of consideration. Junk science. We're going to talk about that standard of care. A big part of the proof of standard of care is expert testimony. Well, junk science is not something that can be relied on. So an expert can't come in, or even the defendant themselves or the plaintiff, and say, here is, our theory of what the standard of care should be in this case. And they cannot just look to junk science or something that hasn't been established in the profession as being actual scientific method that has been proven. That's why there's so many institutions do clinical trials. actually really get evidence on treatment and what is, the standard of taking care of a particular situation, and that goes into standard of care. So you couldn't have an expert come in and say, oh, I think the best way to treat infections is to pour orange juice over it. I'm just making that up. But if there are no clinical trials, no studies saying that, topical orange juice poured on top of an infection is going to help, then an expert would not be able to come in and say that. And there's motions that you can have in court to actually not allow that type of evidence, or not really evidence, but that type of testimony to come into the case to establish the standard of care. So what is relevant to the standard of care? Well, it's really based on objective criteria determined by the profession. So you may have, again, for example, the American College of Surgeons say that, in an appendectomy case, this is the standard of care that we think, is, should be followed, and this is the standard of care. Now, they will not have maybe one particular standard, and that's another thing to address, is that there's not one way of doing something. There may be 3 good ways of doing it. So just because the healthcare provider chose, way that, type A rather than B and C, doesn't mean that A is wrong, even if there's a bad outcome. As long as A is a standard of care and can be established as the standard of care that's acceptable in the profession of treating a particular situation. So objective criteria that's determined by the profession. Evidence-based practice, and there's where we come into clinical guidelines, clinical studies that are dependent on and are oftentimes written up in the literature as this is evidence-based. We've done studies on this, and this is a good way to treat this. It's become the standard of care. Respectable minority rule generally refers to the preferred method may be, let's treat this person according to, type A of way of doing it, or treatment A. But treatment B may also be acceptable. It's just that a minority of providers actually adhere to that and think that that's a good way of doing it. But as long as it is an acceptable and proven to be a standard of care, even though it may not be the one adopted by the majority of providers, it can still come in as the standard of care. And then again, the standard held out by the healthcare provider, which, as we say, if you hold yourself out and say, I am a plastic surgeon and I will provide you with the most, beautiful facelift of anybody ever, and you're going to look like a movie star, then when you come in not looking so much like a movie star and your nose is crooked and, something else may have occurred, then the jury may be, allowed to look at standard of care of not just what an ordinary and prudent plastic surgeon may have done under the same or similar circumstances with perhaps the nose that the person came in with, but they may look at statements by this healthcare provider who's a plastic surgeon who said, I do the best work and I can make your nose look absolutely wonderful, look like a movie star. So if they establish themselves as holding, I can provide a better standard of care than all my colleagues out there, then the judge may let the jury consider those statements as providing a higher standard of care. Does location matter? And again, we used to have the locality rule, but most jurisdictions in the United States now have adopted a national standard of care, which means really with all the technology we have and their standardization among the different professions in terms of required education, national testing, licensure, and so forth, that by and large, we've moved to a national standard of care. So it doesn't matter if you are providing, or care, if you're doing, again, an appendectomy in, Fort Worth, Texas, versus doing an appendectomy in Boston, Massachusetts, versus doing an appendectomy in, Anaheim, California. The standard of care generally is going to be the same. And again, that will be based on expert testimony and the standards within the profession. But location can matter in terms of if you're doing an appendectomy, or maybe that's a bad example, but if a patient comes in, let's use another example, to a hospital that's in rural Texas, and it's a small, 20-bed hospital, and they have a general medical physician and 2 nurse practitioners on their staff to treat patients as providers, they may not have someone who can provide an appendectomy. They say the patient comes in and they have a head injury and they need to have a CAT scan or an MRI to determine. Well, if that facility doesn't own or doesn't have a CAT scan or an MRI, then they're not going to be able to provide that care and would need to transfer the patient. So if it's something that is just not available, then location may come in to the case as a consideration in that way. But if they are set up and they can do an MRI or a CAT scan, or if somebody comes in and they need an appendectomy, if there's a surgeon there that says, I can do it, then they will still be held to the standard of care as they would in a larger hospital in the city. Establishing the standard of care is by and large done through expert testimony. So each side will have an expert, maybe have several experts, but the plaintiffs will have their experts to say what the standard of care was and how that standard of care was breached. And similarly, the defendant, hospital, physician, nurse, whoever may be a defendant, will have an expert to say, no, this is the standard of care and this is how the standard of care was met. Again, despite that there may have been a bad outcome in the case, they still can try to prove, each side will try to prove what they think is the standard of care. And they will be asked questions by the other side about why their standard is applicable and was breached versus the other side. In addition to expert testimony, then the court will often allow evidence to come in on licensure requirements, regulatory requirements, accreditation requirements. These can come in for individual providers or for a healthcare entity that may be accredited. For example, hospitals are often accredited by the Joint Commission. What are the Joint Commission standards? The Joint Commission says that you have to do these 3 things. You only did 2 of them. That can come in as whether the standard of care was met or not. It will also look at policies, procedures, bylaws, and rules. Now, if we're talking about in a hospital or a healthcare entities, the policies and procedures may govern everyone that's practicing in that facility. It may cover only a particular people. There may be policies that are specific to the intensive care unit. There may be policies that are specific to the emergency department. Then the medical staff will generally have bylaws that govern the entire medical staff and rules and regulations that the medical staff have to abide by. So in looking at whether an individual provider, physician or nurse practitioner or a nurse met the standard of care, well, then the policies, procedures, bylaws, and rules of that facility will be looked at. And I can tell you, I've been being mainly a medical malpractice defense attorney for many years, like well over 20 years. And I have had more plaintiffs' attorneys, pull out policies or bylaws or rules and find one that, wasn't followed to the T and actually try to prove to the jury that the standard of care was not met in this case because this particular physician or nurse didn't follow the policy in this aspect. And it may or may not be applicable. That will become a fact issue in the court, but policies are frequently used by the plaintiffs in a healthcare liability lawsuit. Professional organizations, again, the American College of Surgeons, various professions will have professional organizations and they may establish various types of standard of care. Experts will often look to peer-reviewed journals, reference literature as establishing the standard of care. And that's where we get into, again, there may be more than one option as the standard of care. There may be several ways to treat a particular condition, and it would matter that the one that you're, trying to say was applicable is in the peer-reviewed journals, reference literature, and so forth. And then manufacturer's instructions. And this is particular for any type of equipment or medication. They will look at, what are the manufacturer? What does the drug company say? How should this particular medication be used? Did you use this correctly? Was this used off label? And those types of questions can come in determining the standard of care. So a couple of examples that were actually in an actual case that I had at one point in time, but this is an example of how the nursing experts, or it's really the plaintiff's experts, use of hospital policy or used hospital policy to establish the standard of care. And again, this was the plaintiff's nurse expert trying to show that the nurse in the hospital was negligent in providing care to the patient. And this was a teenager who had come in to the emergency department and had abnormal vital signs and ended up having to have surgery later. And they alleged that there was a delay in care and a harm to this person or to this teenager who did end up having a code and had some fairly severe complications and side effects from that. So this is in the report where they look at the standard of care. The nurse violated the standard of care by failing to take vital signs in accordance with the hospital's policy. The nurse took vital signs, and it goes on to describe what the nurse did, but then went back to, and then the expert pointed to the policy and said, no, according to the policy, here is the policy indicates the vital signs were to be taken every 30 minutes or less. And the nurse failed to follow this policy. So they will look at, here's the policy, here's how it wasn't followed. Another example is this was, again, the plaintiff's nursing expert's opinion that failure to notify the physician of patient information violated the standard of care. And so they were looking at that the nurse did not notify the physician of a significant change in the patient's condition. And so they go through what the vital signs were, how they changed, that they were progressing, and that the standard of care required the nurse to report these changes to the physician at a certain time, and they did not do so. And again, that's expert testimony based on what the nursing expert says, here's the standard of care, this is what should be done. The final one that we'll look at is the nursing expert's use of the state licensure board's rule to establish the standard of care. And they looked at, and this was a Texas case, and the Texas Board of Nurse Examiners has standards of practice. And one is this one that's up here on the screen, that a nurse must clarify any order or treatment regimen that the nurse has reason to believe is inaccurate, and that they would consult with the appropriate practitioner or whoever wrote the order to make sure that it was an appropriate order or clarify it in any way that needed to happen. In this situation, they said that there was no, the patient should not have been able to be discharged with these life-threatening laboratory results, and that the nurse should have gone up the chain of command and questioned the order to discharge the patient and so forth based on the lab results and the physician's decision. So, in that type of situation, what I generally tell nurses is go first to the person that wrote the order, make sure that they have all the information they need. If you really still don't understand, ask them, why are you doing this? This seems to be a problem because here's what the lab work still says. And if if they say, don't worry about it, this is my decision. Not a good answer. If they say, here's the reason why. In this particular situation, I understand those lab results are abnormal, but here's why I'm making that decision. If it helps the person understand, they may be able to move on and follow the order. If not, then again, hospitals have chains of command that are established to go up the chain of command. But sometimes that's hard to do in a timely manner, and to do that because it won't happen, immediately or quickly. But many lawsuits bring in chain of command in terms of, was the standard of care followed, and you should have gone up the chain of command. So that's all that we'll do for today. We'll come for this particular segment, and we'll come back and do another video